Feel Good Breakfast Show.
SALOME Polycos helps regulate menstruation and reduces the male sex hormones. Get the help you need for PCOS with SALOME. Your journey matters.
We are also putting the focus on female health. Now, something we've heard all the time is PCOS or PCOS, and it's one of those things that really affect women, and often it only gets detected once women try to conceive. But what about women that do not want to conceive? How do we treat it? What is that? And of course, we have gynecologist and Dr. Lynelle Kenneth with us today, and she's here to just talk us through the differences when it comes to treatments. Doctor, for those who don't know what PCOS or PCOS is in terms of how it's diagnosed, can you just refresh our memory?
Thank you, Zoe, and thank you for inviting me on the show and discussing an important topic. So the diagnosis of PCOS is not an easy one to make, especially in young ladies and adolescents. We look for specific criteria before we can actually say that a patient has got PCOS. One of them being irregular cycles is what they usually come to us complaining of. The others might be features of what we call hyperandrogenism, which in simple terms means a higher type of male hormones or testosterone levels, and that usually manifests with acne and increased hair growth. And then the last criteria we look for is on ultrasound, we look for what we call a polycystic ovary. Like I said, in an adolescent, we have to firstly exclude other conditions such as thyroid dysfunction. They often have irregular cycles for up to 3 years. So you'd need to do a full workup before labeling a patient as having PCOS. And lastly, an adolescent ovary, for example, would look multicystic or multifollicular on an ultrasound. So it's tricky in a younger patient. So we usually try not to label them with that diagnosis until we've done the full workup and investigations.
Is a workup like that very invasive for a young lady?
So in patients who are not yet sexually active, we try to not do anything that involves an internal examination. So for example, the ultrasound would be done as a transabdominal scan, and we usually ask them to come with a full bladder, which is usually helpful to then visualize an ovary in that fashion. But we might still miss it, and then we have the blood investigations that we need to do to also look for the metabolic components. So it's a combination of hormonal and metabolic features.
Now, Dr. Kenneth, there are quite a few women that have PCOS and they don't even know it. What are the implications for not treating it or leaving it untreated?
So like I mentioned, Zoe, the chronic complications could involve metabolic problems, and we look at metabolic syndrome, which includes things like high cholesterol, hypertension, the development of diabetes later on in their lives, and then lastly, they could be at risk of endometrial cancer as they get into their latter years, 50s and 60s. So there are definitely implications if it's left undiagnosed and untreated.
What can we use in terms of to help those who have PCOS or have been diagnosed with it? How does the help of inositol help with the management of some of the PCOS symptoms?
So one of the large aspects of PCOS is something we call insulin resistance. And that is a feature that we find in both our lean patients as well as our overweight patients. And with the help of what we call insulin sensitizers, we try to reduce the levels of circulating insulin. Inositol-containing compounds have shown to be beneficial in reduction. However, it has been used in combination with other insulin sensitizers, and I can't overemphasize the benefit of diet and exercise. That's going to be the mainstay of treatment, whether one is trying to conceive or not trying to conceive.
Well, Dr. Kenneth, thank you so much for joining us today and, of course, shining the spotlight. It is so important to broaden our understanding on different women's journeys, and today's discussion really opened up the platform for just that. And with SALOME, your journey matters.
Cysts in the ovaries, irregular or missing periods, and high male sex hormones are symptoms of polycystic ovary syndrome. If you experience 2 of these 3, you may have it. It's also the leading cause of infertility in women. SALOME Fertility helps regulate ovarian function and helps improve fertility. SALOME Polycos helps regulate menstruation and reduces the male sex hormones. Get the help you need for PCOS with SALOME. Your journey matters.